I left the scan before I got to my house 10 miles away. He was on the phone, saying, I need to see you. And so my wife and I went in, and he said, you have an 8-centimeter tumor on your pancreas. They tell you that 5% of the people make it. And 3 to 6 months is how much you got left. Get your attention. I'm sorry, I'm gonna get your attention. Greater Cleveland is really the epicenter. If you look at CASE and the Clinc and UH, and a lot of smart people are working very, very hard to make life better for people that are sick here in Cleveland.
The CASE Comprehensive Cancer Center is an incredible collaboration of all the cancer researchers in Cleveland under one umbrella. And it includes Case Western Reserve University and the two major partners, the Cleveland Clinic and University Hospitals of Cleveland.
We take two organizations that compete clinically, and yet we work together and we rise above that to collaborate from a science perspective and from a research perspective, and it works.
It's critical that people work together because you never know what's going to overlap. The last surgery that I had that removed the lesions from my liver, well, that came about as a result of work that people were doing on colorectal cancer.
We want our hospitals to compete. In fact, the quality of our medical care probably is better because they're competing with each other, let it be. Yet when it comes to clinical trials or the use of tissues or trying to understand lung cancer or pancreatic cancer or brain tumors, we collaborate all the time, every day.
The theory on pancreatic cancer, and I'm sure a lot of different cancers, is to keep you alive until we can find something that can cure you. And if you don't have people working on that, then where's your hope?
We bring together, believe it or not, 365 professor-level investigators who are studying cancer, both in laboratories and in clinical practice.
We're probably one of the most important cancer centers when it comes to growing our own drugs.
We have a pipeline of over 24 drugs developed from our laboratories that are now going into clinical trials both here at our institutions and nationally.
The more we know, the more science we know, the more we know about this entire field, the more we can continue to develop new drugs to try to make this disease go away.
You got to give people hope, and whatever days God gives me, I want to use it to make sure that anybody that finds themselves in that horrible situation of getting a phone call from their doctor has the ability to access the same hope.
Funding for the next discovery, which will lead to the next advance and the next treatment, is far below what it needs to be.
Anybody that's giving money, is thinking about giving money, thank you, because it's money well spent.
We are doing things that few others even have the capability of doing. And the more funding we have, the more important things we can do.
Sometimes you look at the ceiling and you say, I can't do this anymore. But the message is, you got to do it. And the reason you got to do it is because people love you, one, and two, there's going to be some really smart person at CASE or UH or the Clinic that's going to find a way to make you better. And so everybody has to have hope.